set up the Craniosacral Therapy Educational Trust with a colleague in 1989, really with the intention to provide an ongoing pathway for the study of craniosacral therapy.
After I had a road accident, it was the craniosacral therapy that really helped me through. And I was so impressed with the results that I decided to study it for myself.
I've just had the most amazing results with clients, really deepening and resolving issues that, when they walked in, I just thought, how am I going to deal with this? But it's the work that really works with it.
I was drawn to this particular training because it had been recommended to me, and I'd heard very good reports about it, which all turned out to be true.
I was working in marketing for an investment bank, so I wasn't sure how I was going to work with both together. But it was the best thing I actually did.
We met every couple of months for 4 or 5 days, and in doing so, we could really go over things that we didn't understand, things we'd forgotten, and we did it in a very supportive environment.
I didn't know what to expect, but I was very delighted when I discovered it wasn't just studying and absorbing information. It felt like I found a new family, and you're totally supported every step of the way.
Our teaching team consists of a number of very experienced tutors, some of whom have had, 20, 30, even 40 years of clinical experience within this work.
The standard of teaching during the course was exceptionally high, and what I particularly enjoyed was the balance between the teaching and the practical application of the skills.
There was sufficient diversity in this teaching staff that lent its strength.
We're really there to nurture what happens within their cranial and whatever happens in their personal life, if that affects on their cranial work. We're really there to support that.
Our training is 48 days of classroom attendance. There is also home study that we ask students to do between the training seminars. And we also have a teaching clinic that runs just around the corner from our school in London.
One of the best parts was the teaching clinic. I think that's where I really learned to hone my skills as a practitioner.
The advantages of the teaching clinic was also different from what I expected, but also richer, because we had some really big cases coming in there.
And I think that's where it really starts to happen for people. That's where they see themselves as a practitioner and how they are then going to go out into the world as a practitioner and build a busy practice.
I think the experience of coming here has been so profound for me because I think it's changed me, and I think it's through changing me that it's not just about learning techniques. It's about a way of being and a way of being with the patients, and that's not something you learn in a week. It's something that develops, and that is what I think this school brings to the work.
I was being taught how to act as a catalyst for the body's natural healing. And I thought that I had discovered the secret of the universe, and I still do.
The teaching was completely rich, powerful, just extraordinary.
There was a lot of tears, there was a lot of laughter, and it was all together, and you were all learning together and deepening together and supporting each other together. And I've made some friends for life out of that. So, yeah, I loved it.
The skills that I learned in craniosacral therapy were absolutely indispensable to the role I had in 2010-11 as the Lady Mayoress of the City of London, which allowed me to stay alive and thrive during the year.
When I saw what craniosacral therapy could do and what it has done for me and my family so far, it gave me this new hope.
You set off on your life trying to help people out of pain, and then you managed to do it.